Imagine the worst headache of your life. A throbbing, blinding pain that won't stop. Today, you take a pill. 5,000 years ago, the cure might have been to let a healer scrape a hole in your skull with a sharpened stone. This was ancient medicine, a desperate, often brutal and sometimes brilliant fight for survival. For almost all of human history, we had no idea what germs are. So, when our ancestors got sick, they were battling an invisible enemy. Their methods look shocking to us, but they weren't random. They were logical steps using the only tools and theories they had. So, what did ancient humans actually do? First, they had to answer a fundamental question: what caused the sickness? Without germ theory, the most logical explanation was the unseen world. Illness was often seen as supernatural punishment, an angry god, a displeased ancestor, or an evil spirit that had invaded the body. In ancient Greece, a popular theory was the four humors. They believed health was a balance of our bodily fluids: blood, phlegm, black bile, and yellow bile. Too much black bile? That could lead to a melancholic temperament. Sickness was a sign that these fluids were out of balance. So, diagnosis was a detective story for the soul and body. Healers, who were often also priests or shamans, looked for signs. They observed symptoms closely. They might examine a patient's urine, its color and smell. They used divination, like interpreting dreams, to try and understand the will of the gods. The goal was to figure out why the invisible forces had turned against the patients, because the treatment depended entirely on that cause. And that's where things get insane. The ancient medical toolkit was a mix of the physical, the botanical, and the spiritual. Let's start with the physical and surgical. For severe head trauma, or what they thought was a trapped spirit causing madness, they performed trepanation. Using a sharp stone or a drill, they would cut a hole into the patient's living skull. We know from healed bone that some people survived this. It might have relieved pressure from the fracture, but to them it was about releasing the evil. They were also practical trauma surgeons. They set broken bones with splints and bandages. They sutured wounds with natural materials like plant fibers or animal sinew. They used cauterization, sealing a wound with a hot iron to stop bleeding. These were direct physical solutions to visible problems. Then there were herbal and natural remedies. This is where generations of accidental discovery came in. Through trial and error, they built a vast knowledge of plants. Willow bark was chewed or brewed for pain and fever. We now know it has properties similar to aspirin. Honey was smeared on wounds as a natural antiseptic. They even used moldy bread on infections centuries before we understood penicillin. Sometimes they stumbled onto effective practices without knowing why. For example, a wound left open might become infested with maggots. Observant healers noticed these wounds often healed cleaner. They didn't know the maggots were eating dead tissue, they just saw it work. And finally, the ritual and spiritual. If the cause was an angry spirit, the treatment had to address it. This involved chants, prayers, sacrifices, and exorcisms. The ritual was as crucial as the poultice. It treated the perceived root cause, giving the patient and the community a framework for healing and hope. So, with all this, the drilling, the chanting, the moldy bread, what actually worked? A lot of it did, but not for the reasons they thought. The surgery, like setting bones, saved lives by fixing immediate trauma. The herbs, like willow, had real biochemical effects on pain and fever. And the rituals, they leveraged the powerful placebo effect and reduced stress, which can genuinely aid healing. Of course, if the failures were catastrophic, Treatments like excessive bloodletting or using toxic substances often weakened or killed the patient. The line between poison and cure was discovered through tragic trial and error. We shouldn't look back and just see our primitive brutality. We should see the origins of the medical mindset. Ancient healers were the first observers, meticulously noting what seemed to help. They viewed the patient as a whole mind, body and spirit. And most importantly, they established that when something is wrong, you try to intervene. You don't just wait. Their methods were born of a different understanding of the world, but their goals was the same as a doctor's today: to heal, to understand, and to fight back against the suffering and sickness. They used the science they had, and in doing so, started us on the long path to modern medicine. What's a medical practice we use today that you think will shock people in the year 7000? Let me know in the comments. And if you found this dive into our past fascinating, I'd appreciate a like or a subscribe for more. Thanks for watching.